Hi everyone, my complex case is on a 75-year-old Asian male that presented to the clinic status post-fall that occurred 5 days ago after having an x-ray of his knees performed. The patient reports he fell onto his left hip when he was trying to put his clothes back on. He denies hitting his head, denies loss of consciousness. Patient reports mild pain to the left upper leg, but states he has tried nothing for it. In addition, he reports feeling lightheaded in the mornings while getting out of bed and sometimes when bending over, which has been going on for months. The patient has Medicare Part A and B, past medical history of arthritis, prostate cancer, diabetes type 2, hyperlipidemia, hypertension, and chronic kidney disease. Past surgical history of prostate surgery as well as a knee arthroscopy. Allergies to ACE inhibitors, statins, allopurinol, meloxicam, Uloric, and Tessalon pearls. Medications that the patient is on: he takes 325 milligrams of aspirin daily, 0.2 milligrams of clonidine BID, 400 milligrams of magnesium oxide daily, 1,000 milligrams of metformin TID, 50 milligrams of metoprolol BID, 1 milligram of Prandin TID, 50 milligrams of Ultram Q8 hours PRN pain that was just recently prescribed, 10 milligrams of Vesicare daily, 5 milligrams of Onglyza daily, and then 50,000 units of vitamin D weekly for 8 weeks, then to reduce to monthly. Past family history: his mother had type 2 diabetes. Both of his parents are deceased. The patient is unsure of the cause of death, and he does not have any siblings. Social history: occasional drinker, reports drinking approximately 1 to 2 drinks per month. Denies drug use, is a former smoker with a 29-year pack history, and quit smoking in 1992. Review of systems: so what is positive and relevant to his chief complaint? Patient denies any change in activity or appetite, denies fatigue, denies chest pain, palpitations, and leg swelling, denies polydipsia, polyphagia, and polyuria, denies difficulty urinating or urinary frequency. Musculoskeletal: he does report arthralgias to bilateral knees, and back pain, which is chronic. Denies any difficulty with walking or joint swelling, and is, of course, now complaining of mild pain to the left hip, left upper leg area. Skin: he reports bruising to the left upper lateral thigh. Neuro-wise, he does report lightheadedness upon getting out of bed and with position change. Denies tremors, seizures, weakness, numbness, and headaches. Vital signs: blood pressure was 134/90, pulse of 72, respirations 18, temperature 97.9. His weight is 167 pounds, and his height is 5'5". Recent lab work that was done on January 19th. What's relevant: he had a magnesium of 1.9. His UA was normal. His CBC showed a slightly decreased hemoglobin of 13.1. His uric acid was 4.5, and his CMP, which was drawn at 4:50 in the early evening, showed a glucose of 53, a BUN of 20, a creatinine of 1.21, and a GFR of 58. His last A1C was on December 14th, which showed it being 6.7, and a vitamin D level of 28.6 on December 14th as well. On the 19th of January, when he had the x-ray of his knees because of a complaint of bilateral knee pain, which is when he fell, that x-ray showed marked degenerative changes without evidence for acute fracture, but it also showed osteophyte formation. So physical exam, patient is alert and oriented ×3, does not appear to be in any distress. His heart rate is regular, normal, no adventitious heart sounds, S1, S2, intact pulses. Lungs are clear bilaterally and throughout, no distress noted. Musculoskeletal, he does exhibit some decreased range of motion and deformity to both knees and tenderness upon palpation. His lumbar back shows that he's exhibiting some decreased range of motion, as well as decreased range of motion and tenderness to the left hip and left upper leg area. He did display an abnormal gait, and then skin-wise, he did show bruising. There is apparent bruising to the left upper lateral thigh. And I will end there. Thank you.